So please start sending in your questions as soon as possible so that we can take as many of them as we can. And as usual, the WhatsApp number to use is +251 455 2310. That's +251 9455 02310. Today we are coming to you in English, so please, there is no interpretation today, but I'm sure that the English language will suffice. All right, you can ask your questions as well through the question and answer section, or you can come in live to us. Let me not waste too much time and hand over immediately to Dr. John, the Director of the Africa CDC, for his briefing. Dr. John, good morning, welcome, and you have the floor.
Thank you, Wayne, and let me join you in apologizing for the slight delay. It was caught up in an urgent visit with one of our ambassadors who are like our permanent representatives, and we do answer to them. So it is always a joy to be with you on this platform to discuss the evolving trends and the situation of COVID on the continent. As of today, June 24th, 9 a.m. East African time, a total of about 5.2 million cases have been reported across the continent. And that represents 3% total when you compare that globally. In terms of recovery, about 4.6 million people have actually recovered on the continent. And this represents 88% of the total cases reported. The total number of deaths stand at 139,000. And that is a case fatality ratio or fatality rate of 2.6%. Now let me look at, when we look at the 5 countries that are producing the most caseloads, they include South Africa with 35% of all cases in Africa, Morocco 10%, Tunisia 7%, Egypt 5%, Ethiopia 5%. In terms of variants of concern, what we call VOC, 55% of our member states, that is 30 countries, are now reporting the Alpha variant. Just for the records, the Alpha variant is the B117 variant that was originally reported in the UK. 53% of the member states, or 29 countries, are reporting the Beta variant, that is the B1351 variant that was originally reported in South Africa. 24% of our member states, or 13 countries, are reporting the Delta variant that was originally reported in India. So let me now switch our attention to the weekly trends and then the 4 weekly trends. So between the period of 14th to 20th of June, if you compare that week with the current week that spans from, or last week that spans from the 7th to the 13th of June, as a continent, we have recorded 159,000 new cases. And this represents a 30% increase from the previous week. The highest proportion of new cases are coming from the Southern African region, with 63% of those, North Africa 17%, East Africa 11%, Central Africa 2%, and West Africa 2%. The following 5 countries are reporting the highest number of new cases: South Africa, Zambia, Tunisia, Namibia, and Uganda. In terms of death, last week we observed a 19% increase in number of new deaths. That is a total of 2,800 new deaths were reported compared to the previous week where we reported 2,300 deaths. If we now look at a 4 weeks trend, we observed that an average of 23% new cases have been reported across the continent. And the distribution by region is as follows: 40% increase in Southern Africa, 25% increase in Central Africa, 15% increase in East Africa, 4% increase in Northern Africa, and 1% decrease in West Africa. In terms of deaths, as a continent, we have observed a 7% average increase in new deaths across the past 4 weeks, with Nigeria, DRC, South Africa, Kenya, Ethiopia, and Egypt, Kenya observing increases, but Egypt and Ethiopia have reported both 12% average decreases over the last 4 weeks. In terms of testing, as a continent, we have conducted 51 million COVID tests. 1 million tests were reported last week, that is the week of 24th of June. That is the week spanning 14th to 20th. And this represents a remarkable increase of 16% compared to the previous week. Our case positivity rate remained high at 10.3%, and the test per case ratio is around 9.7%. A few countries that we need to add here with respect to high positivity rates. Last week we mentioned a number of countries that are on that list of high positivity rate, but this week we are adding Eritrea, Liberia, and Rwanda. So in terms of what Africa's CDC is doing across the continent, we on June 17 trained over 700 healthcare workers in 40 member states in infection prevention measures. And just yesterday, we published new guidelines on IPC, which is Infection Prevention Control for Primary Healthcare. And we continue to make progress across the continent in terms of training vaccinators. So let me now switch attention and speak on the situation of vaccines on the continent. As of today, a total of 61.4 million COVID vaccines have been procured by 51 member states in Africa. A total of 48.6 million vaccine doses have been administered, which corresponds to 79% of total supply in Africa. So of the 60 million or 61.4 million, 48.6 million, about 80% have been used. So I think that is a very good uptake. So again, these numbers speak to the fact that if vaccines are available, people are willing to use it on the continent. Vaccines must be available in a predictable manner so that countries can arrange themselves, organize, work with partners to ensure that they are used immediately. The total coverage, however, remains at 1.12% of the population that have been fully immunized. Fully immunized meaning that they're receiving the 2 doses. And this represents a slight increase of about 40% compared to last week. If you recall, last week we were around 0.78%, and this week we are around 1.12%. Again, my interpretation of this is that there's so much talk about vaccine hesitancy on the continent. It's in function of predictability of vaccines. If the vaccines are available, people will step up and use the vaccines. A few countries are have still not received the vaccines: Tanzania, Sahrawi Republic, Eritrea, and Burundi. On June the 7th, the Health Ministry of Egypt said they were starting production of locally in Egypt of the Sinovac vaccine after signing an agreement with China to produce locally and distribute the vaccines in Egypt and other parts of Africa. The first vials are due to be produced on June 15, and up to 6 weeks will be needed for checks before they are put in use in vaccination centers. So I think that is very, very aggressive. As I said earlier, the reason I was slightly late for this meeting was that I was receiving the Honorable Ambassador from Egypt, who was just explaining that initiative to me and urging that we put that into a continental vaccine strategy, and urge that I do pay a visit to Egypt to look at what is going on with that vaccine manufacturing, which I happily accepted that invitation, which we will be making a trip there to see what is going on there. On June 7, Senegal will begin producing, according to the announcement, they had COVID-19 vaccines in 2022. And this is under an agreement with the Belgian biotech group, Universal. I think very promising and encouraging that in next year, 2022, Senegal will begin to produce that. Again, couple that with the good news from Egypt, I think we are extremely pleased with that. On June the 22nd, the World Health Organization, as you recall, made an announcement that there will be a vaccine manufacturing hub in South Africa. And that is also going to be a boost to our vaccine manufacturing efforts across the continent. On June the 16th, CureVac announced results of a trial from their product, which they only showed 47% efficacy on that vaccine, which of course we've had remarkable successes in producing. We collectively, as the world, have seen remarkable progress in the areas of vaccine efficacy, and this is not surprising that some vaccines will suffer setbacks. So when that is the situation of COVID as of this week, and I will return it over to you.
Thank you very much. That was Dr. John, the director of the Africa CDC, with that briefing that contained a mixed bag of good news and some not so good on the COVID-19 front. But now is the time for you to put forward your questions so that you can get the specifics of the situation. Let me start by going online today and calling Gabrielle Steinhauser. Gabrielle, I believe you are calling us from the Washington Post.
The Wall Street Journal, actually.
The Wall Street Journal. Please go ahead.
No worries at all. The latest sequencing data from Uganda shows that the Delta variant seems to have completely crowded out other variants in the country in June, just when infections there were rising dramatically. And I'm just wondering if you're seeing other changes in the sequencing data you're getting from member states where you're seeing similar increases of the Delta variant, and how concerned you are as you receive more data about what this variant could do in African countries where so few people are vaccinated and so few people are fully vaccinated. Thank you.
That's a very excellent question. We are seeing that the variant really aggressively taking over from other variants, not just in Uganda, but in other countries like the DRC. I was just analyzing the data a few minutes ago, and it's remarkable that within 6 weeks, that variant in DRC became a very, very predominant variant. And with that analysis is going on across several member states to understand what the situation is. As we speak, Africa CDC is hosting an important workshop in Nigeria, where we've brought together so many experts across the continent to work on and analyze and continue to generate data on the variants across the continent. One thing I omitted to mention is clearly that we are in the middle of a third wave. At least 20 countries are now fully and in the middle of their third wave across the continent, and it is very devastating. One thing we see is that the peak of the third wave is remarkably higher than the peak of when we had the second wave. So that speaks to the fact that there are several factors contributing, and maybe, and just maybe, the variant in question is the Delta variant is perhaps playing a very significant role. We will analyze it, continue to analyze the data and share that with you.
Thank you very much. Let me take a question that's coming in from Kara Anna from the Associated Press. And Kara says, thank you for the briefing. What are your concerns as the virus spreads further into rural areas that are relatively unequipped to respond to it?
Kara, that has always been our greatest fear, that if we do not do something and do it quickly, then the virus begins to spread and seed itself in remote areas. And it becomes extremely difficult to do mopping up operations. And that will become the beginning of endemicity of the pandemic. And we shift from a pandemic to just begin to think of how do we manage this in terms of an endemic disease, just as we do with malaria, TB, and HIV. Nobody wants that. The solution we had was to do rapid scale-up vaccination, which unfortunately the numbers speak for themselves. We had around 1.1% coverage there, which is far removed from a target that we were expecting to be at this point. So very unfortunately, we are seeing that. The good news, however, is that based on analysis, a majority of the case load is still in major cities. We looked at the Zambia data very carefully yesterday with the leadership of the Ministry of Health of Zambia, and a lot of the new cases are occurring in Lusaka. So that means that if we implement public health measures and scale up vaccination in major cities, we can actually blunt the spread of those viruses into the remote areas. They themselves admitted that Lusaka is really the turning point where they actually move orchestrate transmissions to those remote areas of the country. So again, the key is vaccination. We have to roll out vaccination. Public health measures alone will not stop the virus from spreading to remote areas.
Thank you very much, John. Now let's call upon Dr. Diallo. Dr. Diallo, please give us the news agency that you're calling from and then ask your question. Dr. Diallo, can you hear us? Your microphone is muted. Please unmute your mic, Dr. Diallo. All right, let's move on and take someone else who's joining us online, and that is Sophie Mukwena from the SABC. Good morning, Sophie.
Good morning. I just want to find out from Dr. Nkengasong, South Africa is experiencing surging numbers, particularly the province of Gauteng. Yesterday, the stats were really shocking. What could be the reason? Is South Africa battling a challenge of the Delta variant, or is it still the variant that we know that was detected in South Africa? Secondly, the slow pace in terms of access to vaccine or vaccinating the population in South Africa, with the level of numbers or the level of aggressiveness of this virus in South Africa. Are you not worried? What are the health officials saying? What's the problem? I mean, even to access vaccines, the COVID facility, we haven't received any consignment from COVAX while we had procured vaccines through this facility. South Africa is in a crisis.
So thank you, Sophie. Let me say that, let me start with the last question and work backward. The situation of access to vaccines on the continent as a whole is, to me, a moral challenge, a moral dilemma for all of us. We have heard pledges across the world, but we all know that unless and until we see those pledges transform into vaccines arriving in hospitals and vaccines that are put into people's arms, that doesn't solve the problem for the continent. The continent is lagging behind. There's no other way of putting it other than the fact that we are completely lagging behind. We just don't have vaccines enough for the continent. Enough, perhaps, is not a word to use, is that we just simply don't have vaccines, period, for the continent. As I indicated earlier, about 1.1% of the population has been fully immunized, and this is a continent of 1.2 billion people. So that is the situation in South Africa is not different from what we are experiencing across the world. It's the same issue we have all discussed over and over, that certain countries bought all these vaccines. COVAX had the money but they didn't know where to go get the vaccines. And I think we are all in that situation. However, I remain hopeful that come the next couple of weeks in August, through the AVAC mechanism, the African Vaccine Acquisition Task Team that was set up by President Ramaphosa when he was the chair of the African Union, will begin to release doses of vaccines through a contract that we have signed with them, which I've explained severally on this. So hope is on its way. Let's wait, give it in the next few weeks. Beginning of August is not far. We are already in discussions with countries, send them note verbals to explain that they should be ready to receive their first doses of the vaccines, Johnson & Johnson from the AVAC. So that is unfortunately the situation on the continent. In terms of why the situation is what it is in South Africa and also Southern Africa, I would also believe that the situation that the winter situation in Southern Africa is a factor, because of when it's cold, people tend to be indoors a lot, and we know that there's a lot of transmission indoors. On that note, Sophie, I would like to say that I'm encouraging all countries in Southern African region to pivot their message to that. You don't just wear masks in public, but indoors you should still be extremely careful. A lot of transmission occurs in households, where people come from outside with the virus inside, and then they believe that they feel the warmness of home, they are comfortably in homes, and they do not exercise those same measures that are required out there. So I think I really urge that countries lay emphasis, especially in the midst of this third wave, to actually prevention measures that are indoors oriented. Avoid gatherings indoors. That offers a lot of space for the virus to transmit. And I think with that, we will be able to bend it down, the curve down again. With new variants, I don't know, I have not quite frankly looked at the genomic situation of the variants in South Africa the last couple of weeks. I will be reaching out to our colleagues, Professor Tulio, to see what their database is telling them. We work very, very closely with them, and I think in the next coming days or so, we should be able to know whether the Delta variant is behind what we are seeing in South Africa, or it is the same B135 variant.
Thank you very much, John. We say good morning to Paul Adepoju. And Paul says, what is your assessment of the third wave across Africa? Which countries are worst hit? And how prepared are member states? And what is the contribution of the Delta wave to the third wave on the continent?
Several countries have been hard hit, Paul. As I indicated, about 20 countries already in the middle of this terrible third wave. And what is unique and common across the board is that the peak of this third wave is remarkably higher than the second wave. So it's more severe than the second wave. And that has consequences in terms of a healthcare system being overwhelmed. And this is the first time that we are beginning to see countries report that their health system, the hospitals are completely overwhelmed. Yesterday, as I indicated, we had a very long technical call with the leadership of the Ministry of Health of Zambia just on that. And we will be dispatching a team of experts to Zambia in the coming days. We already yesterday, after that call with them, dispatched a whole consignment of response commodities to support that way, because they are completely overwhelmed. And you look at DRC, I'm sure you heard the president of that country just last week making in a press release saying that the hospital systems are fully overwhelmed. Uganda, you've seen how overwhelmed the systems are there. So this third wave has come in with the severity that most countries were not prepared for. And the swiftness of this, I mean, in Zambia, for example, as we look at the data yesterday, it only took them 3 weeks to 4 weeks to be overwhelmed. So this is a virus that sits itself and very quickly takes over your health systems. So the third wave is extremely brutal, and we hope that countries will take drastic measures. If you recall, on the 8th of May, we hosted an emergency meeting of ministers of health, where we said we issued a warning in the communique that we needed an adapted strategy that I've explained on this platform severally, that includes enhanced prevention, enhanced monitoring, and enhanced treatment. We warned at that time on the 8th of May that hospitals should be stocked with oxygen, and that this we saw signs that signal that we will be hit with a third wave. We signal that we should be actually increasing our community surveillance, that is looking for hotspots, using the rapid antigen test to detect those hotspots where could actually become a trigger for the third wave. And here we are with that situation. So I think I'm calling on everyone, including all of us on this platform, to really help to expand that message, share that strategy, which we have it on our website, so that countries can actually implement it. I will today, in the next couple of minutes, at the top of the hour, be briefing a bureau of the head of states meeting on the situation of COVID, and asking them to really make sure that we take that strategy at heart and implement it, because it's frightening to see what is going on across the continent. There's no better way of putting it other than saying it the way it is.
Now let's go on to Edith Mutetia, and Edith is with China Daily. And she says, among the reasons why some people are hesitant to take COVID-19 vaccines is the fear that mRNA-based COVID-19 vaccines could be having unknown side effects that will manifest months or years later. What is your take on this?
My take on this is that I fully understand and respect people's concern when it comes to new technology. But I say that as an immunologist, virologist for close to 30 decades, that technology will not impact your DNA, because that is where the fear is, that the mRNA that is mentioned doesn't even get into what you call the core, the nucleus of your cells, where your genetic material is there, and it completely has no impact. In other words, if we are dealing with a scenario where the messenger RNA will go into the core and integrate into your genetic material, then you'll be having an issue there. That is not the case with this technology. So I think I'm less concerned. Will I take it if I have the chance of taking either the Moderna or the Pfizer vaccine? Absolutely yes, without thinking.
All right, time to say hello to Judith Akolo, who is with the Kenya Broadcasting Corporation. And Judith says, would we be correct to say that Kenya is in a fourth wave? And her second question is the Delta variant responsive to the vaccines being administered on the continent?
Let me start with the last question. Yes, we are still analyzing data to see and find out how these vaccines are protecting against the different variants. As we speak, Judith, we have a team in Seychelles, and the team has been there for close to, this is the second week, actually, that we dispatched a team there to work with the government of Seychelles to begin to investigate some of the vaccines that they are using and their effectiveness. And the reason that we choose Seychelles is that their coverage is very high. We have immunized over 70% of the population. And just a few weeks ago, if you recall, they were dealing with an upsurge in number of cases. So we dispatched a team to work with the ministry to find out what is going on and in-depth analysis of what is going on, so that we have evidence to back up any claim. For now, I don't have any data yet to speak to the effectiveness of the vaccines vis-a-vis the new variant. Is Kenya going through the fourth wave? I think the data that I have in front of me, it would suggest that it is still the third wave. projection. I think that is an analysis that we're just doing yesterday. But again, we still need to look at in depth to see if that is at the tail end of the third wave or they're in the beginning, the fourth wave.
All right, thank you. Good morning to McDonald Zirutwe, who is with Reuters News. So McDonald says, could Dr. Nkenga's song comment on the plans to overhaul the COVAX program? In particular, what are the implications for countries like South Africa, Botswana, and Namibia, who will have to pay for vaccines in advance as they are considered middle-income nations?
I think the issue we have in front of us now is timely access to vaccines. Let me just repeat what I've said before, not necessarily on this platform today, is that we have to vaccinate at scale and at speed. Whether you get your vaccines from COVAX or you get it from AVAC, you get it from bilateral, we have to do that quickly. We are running a race behind time here because the pandemic is ahead of us. Let me put it very bluntly, we are not winning in Africa. We are not winning in Africa, this battle against the virus. So it really doesn't matter to me at this point whether the vaccines are from COVAX or from anything. What we need is rapid access to vaccines to member states. If you look at the graphs of the brutality of this third wave, in Namibia and all those countries that you mentioned, is extremely frightening to see how quickly, within just 4 weeks, the virus have taken over in those settings there. So, I mean, whether we have time to overhaul COVAX or not, we just really will need vaccines to get into people's arms very quickly.
Thank you. Let me take a question from Vijay Shankar Balakrishnan. And Vijay says, I am a freelance journalist representing the Lancet family on this occasion. So he has two questions, but I'll give you the first one, move on to somebody else and come back if we have enough time. So the first question from Vijay is, what is the current status of progress in Tanzania with respect to the new task force's evaluation of the situation? If the results are not out, then on what basis could the Tanzanian government have ordered vaccines as part of COVAX?
That's a very good question. First of all, we have to acknowledge that Tanzania is making progress. The new leadership is making progress in the right direction in terms of opening up and acknowledging the pandemic. That is a very good positive step. The second thing is that we stand ready to work with Tanzania to understand what their needs are. And of course, the news that they are engaged with COVAX is very encouraging. And we will also be engaging with them to see how they can also participate in the AVAC facilities. You heard last week or this week, an announcement that was made with the World Bank and the AU and the AVAC team with respect to the partnership with to support countries to acquire their doses from the AVAC platform so that we can achieve the 400 million doses that we had secured through Johnson & Johnson. And Tanzania will be part of that. So again, encouraging signs in Tanzania, a lot still needs to be done. And we continue to engage them to offer our support for in a whole variety, in several areas of response.
Thank you. Morning, Bonisile Makubu from the Times of Swaziland. Two questions from Bonisile, but I'll give the first one and try to accommodate other journalists. So the first question from Bonisile is, how effective has the last mile program supported by Coca-Cola been in developing countries in Africa?
Quite honestly, I've not, I don't have details on that specific program. So I cannot comment on that.
All right. We move on to Agostino Leite, who is with Lusa, the Portuguese news agency. With a seemingly fourth wave rising in Europe and elsewhere, how does Dr. Nkenga's song see its impact on the flow of vaccines to Africa?
I think, unfortunately, it would, of course, have a negative impact on vaccine flow in Africa. We saw what happened in India. Once people or a country recognizes that they are threatened by the virus, the tendency is to put restrictions on the exportation of vaccines and other ingredients outside of the country. So I would not be surprised that the rise of the fourth wave in Europe impacts severely ability for countries to redistribute vaccines or to rely on the ability to export the vaccines that they already have.
All right, let me come back to Vijay Balakrishnan, who is a freelance journalist representing The Lancet. So he says COVID-19 case numbers are increasingly rising in many countries in Africa. So he goes on to quote a publication of the WHO, which is called Weekly Operational Report. And that quotation that he takes is, the Democratic Republic of Congo, Namibia, and Uganda have reported their highest number of new weekly cases since the pandemic began. And then he asks the question, could you share what's happening on the ground in response to the surge?
No, so it's not just those countries, as I said earlier. I think I went through a whole list of countries that are going through a serious surge in number of cases. There are about 20 countries in Africa that are in the middle of the third wave. And of course, those countries that you indicated are also part of that. So it is a common strategy and holistic strategy is required, which I indicated earlier. There are three things you need to remember: the PMT, enhanced prevention, enhanced monitoring, and enhanced treatment. Let me just speak a little bit on what we are encouraging and advising and supporting countries to do. On our need enhanced prevention, we are looking at two main things. One is we must, I use the word must deliberately, adhere to public health measures, avoid gatherings, okay, whether they are religious gatherings or social gatherings or political gatherings, we have to avoid them because they offer a direct opportunity for the virus to transmit, and especially with these new variants that transmit much more faster than the previous variants. Second is the vaccine, which we have discussed that abundantly. Without vaccines, we cannot blunt this and maintain it, the spread of the virus at a level that we can declare victory there. Vaccines will be indispensable in our war to win this battle. Underneath the M, the monitoring is enhanced monitoring, which is that we need to take advantage of the existing antigen tests and do large-scale screening in different communities so that we can find out the hotspots and then do something with them and engage the community in a very decisive way. Still underneath monitoring is the ability for us to actually monitor the variants. These variants, they come in and then they overtake very quickly, as we have discussed it in the situation in Uganda and in DRC and several other countries there. So we are supporting countries a lot to be able to either move specimens for those countries that do not yet have the capacity or sequence it locally there. When we started fighting this pandemic, we just didn't know about the variants. And here we are with the variants. So we need to adapt our strategy and factor the monitoring of variants as a comprehensive a part of our strategy. And of course, the last part is the treatment. What we mean by enhanced treatment is oxygen must be available. So many people are dying because in so many countries because of basic lack of oxygen. Again, the first experience yesterday with Zambia, it was really sympathetic and pathetic to see what was happening in that country with respect to shortage of oxygen. So where they've run out of capacity completely. So I think it is those are what we are encouraging countries to do. That is what we are supporting them to do, and that's where we are encouraging more partnerships to work with countries to deliver on those three components of the adapted strategy.
Thank you, John. Claire Keaton from the Sunday Times Daily in South Africa. Does the Africa CDC have any data on whether vaccinations in Seychelles have protected people against severe cases of COVID-19 and deaths. And she notes that COVID-19 cases are rising in the Seychelles.
So that is what I discussed earlier, that we have a team as we speak in Seychelles, and just let us have a chance to hear from them when they come back this week. And I'm sure by Thursday next week, we should be able to, or the week after, we would have analyzed the data fully and then be able to make evidence-based statements. But for now, let's give them a chance to do and complete the task ahead of them.
All right, so let's move on to our last question, and we go back to Bonisile Makubu of the Times of Eswatini. She says, is there a change in the manner in which children are affected by the newer variants when compared to the first variant?
Yeah, unfortunately, we are seeing or reported cases of more severe infections in younger population, not necessarily children, compared to when this pandemic just started. So it is very possible that the new variants are having an impact, but we still need to wait and see and have real evidence that that show clear association between the new variants and the infection of the younger population. This virus continues to mutate, and as it mutates, it has consequences in terms of transmissibility. It has consequences in terms of pathogenesis and the clinical outcome amongst different populations. So again, we still have a lot to learn from this virus, and that's why, I mean, I've always been extremely cautious that we celebrate what we have known about this virus, but we remain cautious that there's a lot that we still need to learn, and humble ourselves that we have to work collaboratively to understand what is going on with the new emergence of the new variants. But the solution is in our hands. We have enough vaccines in the world to vaccinate at speed and at scale.
Thank you very much, John. We have about 3 minutes before we close, so it's time for us to hear your final wrap-up points for today.
The key is really a plea for continuous support to the continent that is very desperate to scale up vaccines. And I think the data that I presented today, that speaks to at least 80% use of vaccines that have been acquired. It speaks to the fact that if vaccines are available, people will use the vaccines in Africa. I want us to leave this press conference with that number in mind, that 80% of the vaccines that have been made available have been used. And some of those other vaccines are being reserved for the second doses. I mean, since most of the vaccines are 2 doses there. So if vaccines are available in large amount, we will use it. I want to use that message to dispel the narrative that if vaccines are available, many people will not even use it in Africa. Vaccine hesitancy is not unique for Africa. It is all over the world. And we in Public Health must work with the community, must work with the civil society to make sure that we shift the balance and make sure that people use the vaccines. And lastly, is that vaccine hesitancy is not static. So in other words, if the population of, say, Ethiopia, if you sample the population today and 40% of them say they will not use the vaccine, it doesn't mean that if you sample that after 2 weeks or 1 month, it will be the same. Côte d'Ivoire, for example, you saw what happened in Côte d'Ivoire. Their uptake was extremely low, but with the right communication and engagement with the civil society, religious leaders and others, the uptake became extremely, it changed very quickly and in a short space of time. So again, we are here to work with the media to engage the community so that vaccine uptake can be improved across the continent if they are available.
Thank you very much. That was Dr. John Nkengasong, the director of the Africa CDC. As he said, he has to go off and brief heads of state and government still on the situation of the COVID-19. And I think he has made it abundantly clear the urgency for action and for the continued flow of information, given the status and the trends that we are witnessing across the continent. Colleagues, journalists and communicators, I thank you very much for being with us for the past 15 minutes. I wish you a very happy week coming ahead. And let's meet again next week, Thursday, at the same time, and that is 12 noon East African time. For now, bye-bye.
Thank you. Bye-bye. The slide, let me see what you have.